Thank you very much, Mark. Dumelang, Molweni, Huemore. Good morning, friends, colleagues, and fighters for health equity. Special greetings to Metsepo and our VC and all protocol observed. We would like to stand in solidarity with the Child Institute, the ChildGauge team, and all the partners and researchers responsible for delivering what promises to be yet another insightful gauge for 2021, with a very provocative but yet fitting title, The Slow Violence of Child Hunger. I come from the premise that health is fundamentally a social justice issue, where equal economic, political, and social rights and opportunities are essential for health. I will be highlighting a few key messages drawn from last year's chapter that was the parting gift of the late David Sanders, our colleague, teacher, mentor, and friend to many of us from many walks of life and from many professions. David Sanders wrote about the triple burden of malnutrition in childhood in South Africa, highlighting undernutrition, overnutrition, and poor micronutrient status, for example, vitamin A, zinc, and zinc deficiencies. I'm so pleased that this issue is a core priority for this gauge. Believe it or not, undernutrition and stunting in particular has remained the same in South Africa over the last 20 years at a very high prevalence of 27%. This was in 2016. This is hardly surprising since South Africa is the most unequal country in the world. The richest 1% of South Africans own 2/3 of the country's wealth, with the top 10% owning 93% and the remaining 90% owning a mere 7%. As Metsepo has highlighted, incomes have not grown with food prices increases and more households are struggling to feed themselves. Furthermore, opportunities to escape from poverty are still racially and disproportionately distributed 25 years after our democracy. Less than 1 in 2 Black kids finish high school in South Africa. Women and Black women in particular are the face of poverty. Male-headed households in South Africa have an annual income that is 2/3 more than of female-headed households. Much of women's work is unpaid, further entrenching poverty, poor nutrition in women, mothers that impact child nutrition and health. This was all before COVID-19, and as we've heard from Dr. Zembe, the situation is even worse, trapping even more women and children in poverty and hunger. Friends and colleagues, this is violence. The obesity and this persistent stunting is influenced by the global and the local increase in the consumption of ultra-processed foods that are highly refined, high in sugar, unhealthy fats and salt, low in fiber and micronutrients. And they contain additives to extend their shelf life and to modify their color, flavor, and texture, and are specifically formulated to taste overly lovely and be habit forming, leading to excessive consumption and rapid weight gain. I'm talking about breakfast cereals, biscuits, sugar-sweetened beverages, sweets, snack bars, cheese, bread, processed meats like bologna. What is even more distressing is that in about 1 in 4 children under 2 years old, they already consume these unhealthy sugary foods. And these foods are marketed to children who have limited knowledge to make better choices. And they set dietary habits and preferences which are incredibly difficult to change at a later age, further entrenching obesity in adolescence and adulthood. Although many of the leading brands have committed not to market unhealthy products to children under 12, research that has been done by our colleagues at Vets at Priceless shows that there are billboards that are actually sitting very close to schools and with nearby vendors who are conveniently placed to then fulfill that need of those unhealthy foods. Agricultural and food corporations have been enabled to accumulate super profits by global trade agreements and the consolidation and automation of all levels of or within the food system, from production, storage, all the way to marketing and retail. Not only have these mega food production systems brought in much more unhealthy foods, but they've also resulted in loss of job opportunities in the food sector, increased urbanization, and have destroyed some of the more local, vibrant markets. This exploitation for profit is violence. The level of interpersonal violence in poor urban communities in particular also prevents young people from freely engaging in outside physical activity, further entrenching and increasing obesity rates. Ultimately, for us to attain food justice and to break the slow violence of malnutrition and child hunger, we must understand that we need to transform food production systems, deal with the social and structural inequalities and the institutional power and policy framework that influence our environment, our living conditions, our behavior, and how we function as a society. I lend my voice to congratulate the team for getting the gauge up, even under very challenging and complex context of the COVID-19 pandemic. I look forward to reading it and hearing more about the highlights today. Long live the spirit of David Sanders, long live.